How should these big decisions get made, such as who should get the vaccine first, when vaccinations could begin, paying for it all? And obviously, as you know, I know, we've talked about this, Bill, there's still anti-vaccine sentiment out there as well, which is hard to believe considering what we're going through. But what about these big questions in terms of who and paying for it and when?
Well, if the vaccine is reasonably effective, then you won't have to get 100% coverage. This term herd immunity, which is overused because it only matters when you have high percentage, like over half the population can't be part of the transmission chain. If you vaccinate, 80% of the population and the vaccine is highly effective, say, 90% effective, then you can't get exponential spread. Right. And so then you're in the wonderful situation that you can think of the world like you did before coronavirus came along. The forum that was created after World War II to discuss global health issues is the WHO, and that's all the countries belong to that, and they sit and they discuss and they come up with policies that have to do with quarantine and health checks and things of that nature. So they'll be involved, and there's a group of funders that are thinking, okay, how do we fund this? For even the poor countries, the developing world, they're coming together and talking with WHO. Gavi will help, which buys vaccines for poor countries, will help. The U.S. hasn't shown up in that dialogue yet, but I'm very optimistic, given the history of the U.S. involvement in global health, like malaria and HIV, that Congress will choose to have us show up and contribute and help coordinate and make sure this is run the right way, because the U.S. has deep skills when they're activated.
So are you suggesting that poorer countries or countries with more disenfranchised healthcare systems should be earlier on the list if we're going to roll out vaccines ultimately enough for who needs it or who should get it, but should those countries be earlier?
It's going to be very tough because you're going to have the countries that finance the work. You're going to have the countries where the trial was done. You're going to have the countries where there's the highest infectious rate because social isolation doesn't work there. And under those WHO auspices, lots of discussions will take place. And hopefully the U.S. is there at the table helping those decisions be made in a smart way. It's all modulo how constrained the manufacturing is. If you can make 500 million doses in a month, then you're going to be limited by fill finish, which we're working on that, the final stage of the manufacturing, and just getting the distribution networks out there. If you can only make, say, 50 million a month of all the successful vaccines, then you're going to have one of the toughest prioritization problems ever. Right. And, that's up to regulators and governments. The U.S. can be part of that discussion.
You mentioned herd immunity. I'm just wondering, when you look at what's the path that Sweden has taken, and then you look at their caseload, their death toll compared to Denmark, Norway, other countries in that region, I'm wondering what you make of the way they're going about it. Are there lessons in there? Is it as black and white as it appears, or it seems like if their healthcare system is able to keep up with the caseload, are they just experiencing things in a shorter, truncated time that we are going to ultimately experience?
Well, if you look at different countries got different levels of exposure at different times. And so, Germany, for example, has done things well, but they did have the benefit that they saw Italy being overwhelmed, and their exposure came after Italy, so they were able to respond. But now the exposure in Sweden and Germany were about at the same time. If you look at the IHME, which is a group that we fund, if you look at their forecast, you had Chris Murray on earlier, you look at the death rate in Sweden versus Germany that they forecast, it's way higher up in Sweden. And so, somebody can decide, a politician, if that's what really happens, was it worth it? That's what this is all about, is if you open activity X, are you willing to accept a somewhat higher health burden because of that. Sweden, they made their decision. They seem happy with their decision, but they are forecast to have substantially higher death rate than most other countries.
One of the things in your paper that I thought was really particularly interesting were all the things that we need to learn about the virus, like if it is weather dependent, how many people never get symptoms but are contagious, what symptoms mean, you should get tested. I mean, there's so much we still don't know about this.
Yeah, there are many countries where the epidemic is not nearly as intense as we would expect. And so is it just a delayed effect? Is there something about the vaccines they get in their youth? People think this BCG vaccine might, be a helpful thing. We don't know. And so we have to assume it's going to be as bad in all those countries. In the Southern Hemisphere, you have Brazil, Australia, South Africa have cases. So they're not completely immune, even though the force of infection may be less.
When you famously talked about preparing for a pandemic, anticipating one several years ago. I think you gave a TED talk about this. You